I'm Chris,
I'm Nolan.
and this is our AB project on how to eventually solve lung cancer. Okay, so recently my grandfather has been diagnosed with lung cancer and bladder cancer. He was a avid smoker. He would smoke endlessly, and this has been like very hard on my family because he's been in and out of treatments, and it's been crazy. So this inspired me and Nolan to help create a way to speed up this whole process of diagnosing patients and eventually curing them. But before I get into that, I want to describe what lung cancer is. So basically, it starts off with the buildup of useless cells inside the lung. And all these useless cells don't do what they're supposed to do. All the lung cells are out making the lung work. And these useless cells are just building up in this clump. And this clump forms inside of the lung, and it interferes with the lung's function. This is horrible. I mean, it could lead to death. It's just a mess. So some of the ways you could sense you have lung cancer, all these symptoms include like shortness of breath, rapid weight loss, if you have chest pain or violent coughing, if you never stop coughing, if you have a endless cough and it's disrupting people and yourself, you need to get that checked out. If you're feeling weak or tired all the time, that's just another very big sign. You need to get that checked out because it could be multiple things, but it could be lung cancer. That's not good. So me and Nolan found a way to help diagnose cancer patients quickly, efficiently, and get them to doctors with a tool that will help infiltrate the cancer cell and destroy it.
Studies have recently shown that the diagnosis process for cancer has been unreasonably lengthy and expensive. Jorge Soto has come up with a device named Miriam. Miriam contains a tray with different patterns of microRNA. Within the different patterns, it corresponds to different types of cancer that the patient has. A blood sample is then taken from the patient and put into the tray. With Jorge Soto's app, he takes a picture of it and it's sent off to a lab. Within hours, he gets a picture back with the different types of microRNA patterns in the tray that light up. With the lit up patterns of microRNA, it can determine what type of cancer the patient has. In Jorge Soto's TED Talk, he does a demonstration of this. And he takes a patient's blood sample, puts it into the tray, takes a picture, and he comes back and he can determine that the patient has pancreatic cancer. Right now, they are able to determine pancreatic cancer, lung cancer, and they're currently working on breast cancer in a lab in Germany with 200 female patients. With Miriam, it will speed up the cancer diagnostics across the nation.
So, due to the fact that many Americans have been turned away from cancer treatments in the U.S., there have been many alternative cancer treatments set up in foreign countries such as Mexico and cities like Tijuana. A woman named Sarah McDonald, a reporter, has recently found out that all of these alternative cancer treatments are in fact a scam. They do nothing to help the human body, and they're just a bunch of corrupt individuals who prey on cancer-sick people, and it's just sad, so don't go to them. Okay, so cancer treatment has been tremendously slowed down due to the fact that cancer cells have adapted to being hostile towards chemotherapy drugs trying to destroy them. They repel chemo drugs, but eventually the drug gets to the cell and destroys it. Paula Hammond, a microbiologist from MIT, has created a nanoparticle which has the ability to help speed up this process tremendously. It is wrapped in siRNA, which is a gene blocker which is used to sneak past the cancer's defense wall. In order to get the nanoparticle past the human body's immune system, which normally attacks foreign particles, the nanoparticle is then coated in a negatively charged hydrated polysaccharide, which helps sort of act as an invisibility cloak from the immune system. It is then coated in water to help it flow through the bloodstream efficiently without getting stuck to anything. This nanoparticle is useful because once past the cancer's defense wall, it neutralizes the system, therefore allowing the chemotherapy center to take action and start to break down the cancer cell. It will destroy the cancer cell completely as a whole. The distribution of this nanoparticle will tremendously increase the capability of doctors across the nation to help combat cancer.
According to Cancer Research UK.org, cigarette smoking is the leading cause for lung cancer. To prevent this from happening, we should promote e-cigs to all the cigarette smokers across the nation. E-cigs are electronic devices which contain nicotine in them. With the decreased concentration of nicotine in the e-cig, this will rid the user of their deadly habit. With the promotion of e-cigs across the nation, this will decrease the amount of cigarette smokers, which will lead to the decrease of lung cancer across the nation. An additional part of our plan is to hang up pictures of smokers' lungs next to cigarette counters in convenience stores all across the nation. A way of raising funds for this is to set up a FundMe account, which has been successful in funding many projects across the nation.
From the promotion of e-cigs and anti-smoking ads in drugstores to Jorge Soto's Miriam to Paula Hammond's nanoparticle, the collaboration of these ideas can help slingshot the cancer treatment system into a new level of efficiency, curing patients faster than ever before. Implementing Miriam across the nation will help speed up the diagnostic process for cancer patients across the nation. Once they have been diagnosed, they can be sent to their recommended doctor who will prepare them to be treated. Eventually, they will have Paula Hammond's nanoparticle used on them, which will effectively help break down the cell, making it easier for chemotherapy drugs to take action in the cell. And finally, in order to decrease the whole population of lung cancer patients in the U.S., we can start with promoting the end of cigarette use in the U.S. with our implemented plan of e-cigarettes and posters. The collaboration of these ideas proved to be an effective prototype in attacking one of the most severe threats against our public health that we have today.